with Dr. Schroeder, who's a member of Volpara Solutions Medical Advisory Board. I want to thank you for taking some time with us today.
No, thanks, Erica.
So AI is a hot topic. You're hearing it everywhere, lots of buzz. But really want to bring it down to practical terms and specifically talk about it a little bit in breast imaging and in the radiologist's daily practice. How do you think AI could be of benefit to radiologists in how they read or triage patients?
Yeah, I mean, there's so much information that we need to ingest and digest and understand to do our job that it's hard for us to do that and have a steady, busy clinical practice. So AI, to me, is more of a physician's assistant tool that will, or a physician extender. It helps us do more quickly, more accurately, and integrate information that we can't possibly have in front of us at all times.
So it sounds like, and it's something that we've heard a lot here this week, AI is kind of a buzzword and a hot topic, but really it's just a tool to inform decision making and expertise and really to give you more information at your fingertips.
Absolutely. I mean, I hear people saying, I don't want to talk about AI, it's going to replace me.
Right.
It is not going to replace anybody, not in my lifetime anyway. At some point, the physician with the license and the training has to sign off on that case and take responsibility. And there's no AI that's going to do a better job and have the responsibility to decide that someone has cancer or doesn't have cancer. That's, for the foreseeable future, that is always going to be a human-only tool.
Right. So it sounds like some of it is a emotion and fear and maybe just, you know, better understanding and repositioning AI. But what other ways do you think or things need to happen for tools like that to be embraced by radiologists?
You know, radiologists, like everybody, are a little bit resistant to change. Everybody is comfortable with what they're doing, and change is a little bit scary, but it happens. Radiology, more than any other specialty, has embraced change in technology. And I think what's going to happen, like we see in technology, is the thought leaders, the academics, the people who just push the envelope are going to adopt this, and then everybody else is going to have to use it just to keep up, because it's going to make us better, it's going to make us faster, it's going to make us more accurate, patients are going to demand it, insurance reimbursement is obviously always challenged, and as we get paid less per case, we're going to have to be able to do more cases, and I think the AI is going to help us do that. So it's really going to be a necessity. If you're not using it, you're going to be in big trouble.
Right. It's about speeding your work and giving you also...
And maintaining accuracy. Well, it's not all about speed, but if you can be faster and just as accurate or maybe more accurate, because now you're using pieces of information that you can't put your fingers on, it's going to help.
Yeah, absolutely. Now, what do you think about the specialty of mammography and breast imaging? Do you think breast imagers are uniquely positioned to look at AI tools compared to other subspecialties?
I do. Breast imaging has always been at the forefront in radiology in a couple of places. Data, absolutely. Breast imaging has the most regulation, the most data requirements, the audits, the things that we've been doing for 20 years that maybe the rest of radiology will catch up at some point. In addition, breast imaging was the first place in radiology to even use any kind of AI, if you call CAD AI, and we've been using CAD for, again, about 20 years. And now, for the first time, other parts of radiology are catching up, lung and whatever. So breast imaging is actually a fairly small universe of things to do. So it's maybe one of the easier ones to integrate this kind of information. Plus, it's well studied. We know more about risk and the limitations of our exam, and now we have, you know, other exams that might be recommended for women of a certain risk profile or family profile or density profile. So I think breast imaging is the perfect place for it.
It sounds like there's a lot of different kind of forces underway between, you know, the tools, the data available, the move to personalized screening, population health initiative. But all of them, you know, appear to be data-driven. Are you seeing a big trend in how data is now driving practices and workflow a little differently than maybe in the past?
I don't see it yet, but I see the potential. So Volpara is very intriguing to me. It's why I kind of got involved in the product and guide some of the development things. because with a centralized, anonymized database of all the characteristics of mammograms in women and reports and all that stuff in one server, the things we can learn from it, the research we can do, the benchmarking. So, Volpara will tell me, yeah, my technologist compression is low, and this is how it compares to the 40 million mammograms done elsewhere. That has never been possible before, and it's awesome.
Great. Well, thank you so much for your time. I appreciate it, and we'll continue to watch the trends that are out there.
Oh, that's exciting. Thank you, Erica.